Welcome, everyone, to the Humanized Health Podcast, and it's all about personalizing your health. And before we get started, I want to let you know that we've got lots of great free podcasts here at the Humanized Health website, and you can get transcriptions, video, audio, and we've just been building a great library of some of the real great thought leaders in our industry. And please listen because you're going to learn a lot. And you're going to learn a lot today. And I asked Dr. Sheila Kilbane to be on the program today because, I've noticed just people coming into the store, but I hear more and more in the news um, how sick our children are, how, chronic diseases are just, they seem to be on the rise. And um, that seems sensible to me. Now, sometimes the media hypes things up, so we don't always know what to believe. But I wanted to bring on Dr. Kilbane is an integrative pediatrician, specializes in allergies, eczema, asthma, but she treats children, and being integrative, she relies a lot on nutrition and the food that they eat. And so I kind of wanted to ask Dr. Kilbane about this, and I want to read you a little something about her from her website. This is a quote. Medical school trained me very well to recognize the symptoms of pediatric illnesses and to treat those symptoms. I could easily manage eczema, ear infections, and constipation with daily medications. But the more frequently kids return to my office unhealed after a prescription or procedure, the more frustrated everyone became, including me. After fellowship in integrative medicine and 2 decades of pediatric practice, I developed a method that can prevent or even reverse the common childhood illnesses that keep kids out of school, off the playground, and in a series of doctors' offices. God bless you for that. I just have to say, because, gosh, if we can get our kids on the right track. So, do you see this trend, or in general, is the health of our children getting worse?
Yes, and it's in because in our practice we do integrative functional medicine, we see the kids who are, going to the pediatrician and the specialist, and they're doing everything conventional medicine is recommending, but they're still struggling. And it might be eczema, asthma, allergies, and all the other host of autoimmune conditions, right? Younger and younger, we're seeing kids with inflammatory bowel disease like ulcerative colitis or inflammatory or Crohn's disease, excuse me. And it's we're the other big thing we're seeing, right, are also these food allergies and food sensitivities. And it's these kids and younger and when you really start to dig into this, and we were talking about this before we started today, I recently did a TED Talk. It was a TEDx Nashville. And what the organizer wanted me to talk on was what are these increasing illnesses, especially eczema, because we see a lot of kids with eczema, and what are these rise in illnesses trying to tell us? And so we took it because eczema is such a, it's good to use with a talk because when you look at before and after pictures, it's just an easy way to see things versus, with asthma, when a child is improving, you can't see a picture of their lungs and say, oh, this
Right.
is what it looks like. So with eczema in particular, first, let me give you the 50,000 foot view.
Okay.
Kids today, it's about 1 in 2 kids has a chronic illness,
Oh my
right?
God.
30 years ago, 40 years ago, it was more like 1 in 15. And and so when you look at that, then we and you know take a microscope it down to eczema. So in the 1940s, eczema, the prevalence of eczema, it was about 5%. Now it's about 20%, and it even higher in certain areas of the country, right? That's a significant, we're also talking about stats before this, significant increase
Yeah.
in a short period of time. And so what happened is in the 40s, several things started to happen. It was around the end of World War II, and we began putting chemicals into our environment into our food, into our cleaning products, our beauty products. And we weren't really studying the health impacts of these chemicals. And the EPA, I think it was around the 70s, maybe the late 70s, early 80s, the EPA was required to keep a list of the chemicals that we were putting in the environment. And there is a current list of over 86,000 chemicals that we've put into our environment. And some of them have been studied, but many, many of them have not been studied for their health implications. So we have that. The other thing that happened toward the end of World War II is the widespread use of antibiotics, right? And antibiotics save millions and millions of lives each year. So if you're listening and you need an antibiotic, absolutely take it. What we need to be cognizant of, though, is that the antibiotic not only kills the bad bacteria in the ears, the gut, the lungs, but it also kills the beneficial bacteria that are in the gut and other places. And we'll talk about the microbiome, but what's happening with all of these chemicals and antibiotics is that we've got right trillions of bacteria in our gut, on our skin, in our mouth, in our nasal passages, right? It's the microbiome. And these, if you think about these, think of those microorganisms kind of like the almost like we're like rainforests, like these little mini ecosystems teeming with these microorganisms. What feeds and helps sustain those microorganisms are healthy food, right? Fiber, so nuts, seeds, vegetables, fruits. And the things that harm this microbiome are chemicals, antibiotics, artificial dyes and colors, right? All of this stuff that we're putting in our bodies and on our bodies. And right, we have to have a balance because we can't live in a vacuum, but we've upset the apple cart so much. And when you impact the microbiome plays a significant role in our overall health, right? 70% of our immune system happens in the gut. And we've shifted our microbiome. This is at least in my educated opinion and in practicing peds over the last 20 years, this is what I think is happening. And I want to pause for a minute, but I'll go on about this, but I want to hear your any thoughts and questions that you have.
Well, I think you're spot on, and it ties in with I hear some people talking about what was interesting was I'll share this with you. I met a fellow who wrote a book, and he had an interesting rhetorical question. He said, if every cell in your body worked perfectly 100% of the time, which it wouldn't, but if it did, could you be sick? And the answer is kind of no. So his point was every disease is cell malfunction. So whether it's something serious and then why would a cell malfunction? Well, there's pretty much only two reasons: not enough nutrition and or too many toxins. And so the cure, if you will, for everything is more nutrition, less toxins. And what you said about, I didn't know it was 86,000 chemicals. And to the extent that any of them are studied, they're not studied together and they're
No,
not studied for decades. And I think the impact on a forming child could be a lot different than a fully, adult, and on and on. So I think I think the food supply, unless you're making an effort, is really degraded, and the amount of environmental toxins, and it's really showing up in our children. I think it's showing up in everybody, but I think it used to take us 30, 40 years to get sick. and now we can do it before we're 10. And it's sad.
yeah. And we are for the most part living longer, but we really are in the first generation of kids who their life expectancy is not that of their parents. And that's a pretty hard pill to swallow also. But what the other thing that we know, and like before around the 60s, we used to think that the placenta filtered out these chemicals. When moms are pregnant, we used to think the placenta filtered out a lot of these chemicals. And so the babies were okay,
Yeah, protected.
right? But right, thalidomide was a medication that was used for morning sickness, and that moms would take it, and then these babies were born with partial limbs. And then later, around, I think it was the mid 90s, 80s, 90s, the Environmental Working Group did a study called the 10 Human Study. And they looked at cord blood from 10 babies, and they checked it for almost 400 different chemicals. And they found that in each baby, there were almost 300 different chemicals. That was before they ever set foot on the planet. And some of these were things like Cialis, right, which is a male enhancement
Yeah,
drug, hormones, oral contraceptive pills, albuterol, which is an asthma medication, adult doses of anti-anxiety meds, the SSRIs, right, selective serotonin reuptake inhibitors. And there were also chemicals that had been banned 30 years prior to the study, but they're still in the environment because they end up, they get into the groundwater. And so when you look at that and you look at the increasing rates of pediatric illnesses, and you look at, right, the autism rates used to be 1 in 10,000. Today they're 1 in 31 or 32. And that's just one of, ADHD, anxiety, depression, all of the rates of these illnesses have increased. In addition to asthma, allergies, asthma, the rates of asthma have doubled, in this time frame. The rates of food allergies have increased significantly. So, but that's kind of the doom and gloom. The good news is that kids' bodies are so resilient. And think in terms of, we breathe 10,000 liters of air a day. Let's make sure we have clean air, right? HEPA filters, make sure you don't have, right, moisture damage in your house, make sure there's not mold, get outside, be in the fresh air as much as you can. We drink anywhere from 1 to 3 liters of water a day. Have a good filter. And because we know the city water supplies, they're just testing for bacteria, parasites. We need to look, all these other things aren't like all of these drugs and these chemicals that are in the system of these babies. Some of that stuff is in the water supply.
yeah.
It's not tested by the city water, by the city water facilities. So you want a really good filter, and then clean food, right? We eat 3 meals a day. So you want to get those things sorted. And then you want to make sure your cleaning products, right? We don't need strong bleach. We don't need all of these harsh chemicals. Vinegar and water cleans just about everything. And there, you can do it on for very inexpensive with more natural products. You can spend more money. There are a lot of cleaner companies who are much more cognizant about creating clean products. But then you also have to look at the lotions, shampoo, deodorant, right? We know that phthalates and parabens that are in all the beauty products, we find those in tumors like breast cancer tumors. So you need to get those chemicals out of what we're putting on our bodies as well.
It is important. Fellow we had on here wrote a book, and what he tried to do was once a week you get rid of something. You can't do it all at once, but once a week maybe you go through and you get better shampoos and body care. And once a week maybe you get rid of a lot of your plastic containers. It can seem overwhelming to people, but if you're overwhelmed by all the toxins you may be inadvertently exposing you and your children to, I think the statistics now should be more overwhelming than the fear of, oh, how much stuff do I have to change? Um, I also want to say something about the food. I think sometimes people think, oh, clean food is packages with better ingredients than the packages I used to buy. Now,
Okay.
I'm all for better ingredients, but I've started to just look at the fact that, if you're eating a lot out of packages, that's, it's okay, but you got to get some real food. You got to get food out of the ground. You got to know where it comes from, and just little by little. But the other thing is, we have to set an example for our children, and it's just so easy to give them something sweet and a digital device. Give them sugar and a digital device. And, hey, I'm a dad, so, I understand that it can be difficult raising children and they can be demanding. But I want to switch to your practice because we are going to tell people how to get in touch with you. We've got a lot of good information on your website. But from what you just said, so um, what you do is obviously you help counsel parents in some of these typical things about toxins and food. Um, and is there special testing you do for kids that's, say, different than what they might get from their pediatrician or their
Hmm.
non-integrative pediatrician, I might say?
Yes, yeah. So we always do, and I also want to make sure. So my book, Healthy Kids, Happy Moms, it has our method that we use that Deb Allen, our integrative pharmacist, we've developed this method that we use, and it's always about setting the foundation, right? Cellular health. Make sure we've got good healthy cell walls, make sure our digestion is optimized. We've got to be breaking down our fats and absorbing them. That makes our hormones, our cell walls, our proteins get broken down and absorbed, and they make our neurotransmitters, right? So our dopamine that helps us think and do our math, and serotonin, which helps us ultimately helps us sleep. It gets converted to melatonin. So that's the first thing. The kids who are coming to my practice, usually they have quite a few things going on. And like severe eczema is one of the examples. And
Mhm.
we do we do blood work, whatever we need to, and we do it through LabCorp. There are all kinds of labs that we can
Sure.
use. We usually will use LabCorp for our blood work, and we look at things like a complete blood count, an iron binding package, a ferritin, which is a more sensitive indicator of the liver stores of iron. We look at two different levels of vitamin D. We look at zinc and copper. We do a celiac panel. If the kids are still eating gluten, we look at that on almost every kiddo. And that's an allergy or an autoimmune condition to wheat. And when we need to do environmental allergy testing, we do that, or food allergy testing. We might look at a B12, a B6, a CRP, which is a non-specific indicator of inflammation. So we do regular labs, and then we do a stool study to look at the microbiome. We do something called a urine organic acid test, and that looks at where our bacteria in the gut make byproducts, as do our cells, right? Our mitochondria, our Krebs cycle, and they make byproducts that get dumped into our urine. And so we look at that. It gives us a snapshot in time. It's never No one test is the end all be all. It's just to get an idea of what's going on with the kids and helps us to tailor our treatment. And then we also do a urine mycotox where needed. So if we have any suspicion that the kids have mold exposure, whether it's from the house, and this isn't like mold from a leaf pile, this is mold from a water damaged building.
Hmm.
We'll do a it's called a urine mycotox test.
Well, that's good. I like the idea, the organic acid test or the oat test, as you said. I think of like you see a car going down the highway and there's smelly black exhaust coming out the back. That tells you something about the engine. And
Yes.
and so in a sense, when we look at what's in the urine, the byproducts, we can say, oh, everything looks good. There's not very much of this and there's plenty of that, or vice versa. And I think it's so important um, that, especially for health, that we go beyond just the sort of tests. I mean, I don't know if this is a fair criticism, but I'll make it anyway. It seems to me that a lot of the classic medical blood tests are mostly used to just prescribe drugs or not. Like your cholesterol's high, here's this, your cholesterol's not high, and they're not they're not doing the detective work that they could do from all those numbers. It's kind of like, all right, that thyroid's normal, you're good. That's not your, and what you're doing is really good detective work. Let's real quick. So, if people, where can they find you on the web? And is there a way they can contact you directly? Can you work remotely with people?
So what we do, we're at SheilaKilbane.com is our website, just SheilaKilbane.com. And um we've got a lot of we have a lot of free downloads. We have an eczema jumpstart guide, and we list out, we carry our supplements that we are formulating and curating, and it's a pediatrician and a pharmacist choosing all of these things. And it's very, again, we use things in a specific order, right? We use specific strains of probiotics at certain periods of time, but we have a lot of ways to help you on the website, no matter where you live. And we are starting to be able to ship supplements to other countries. So that's great because we get inquiries
Mm-hmm.
fairly often about that. Um, in order for us to take you on as a patient in the practice, you have to come to Charlotte at least once during our
North
program.
Carolina, right?
Carolina. But we have our online program, and we're just about to do a little bit of a facelift and make it a little bit more accessible for people. And we're going to do kind of up what we'll do. I think we're going to end up doing a weekly Zoom or a weekly like open office hours call with the online course. Right now we do it once a month, but we want to make it a little bit more accessible, so that because it's so many, I would say 50 to 60% of kids, if your child has eczema, asthma, allergies, recurrent illnesses like recurrent ear infections, constipation, belly pain. If you start to shift the diet, you use some foundational supplements, we can usually see significant improvements with nutrition changes, a few key supplements, and physical activity and all that kind of stuff. But it's not always, it doesn't always have to be a stool study and an oat test and a mycotox and blood work. You can see so many improvements with kids just with making those smaller changes.
And let me say to the parents out there, some of us, I think we all get in our habits, our food habits, and some of us won't change to get healthier. And sometimes when you see someone, especially your child, change their diet, change what they're doing, and see their health turn around, it can inspire you, and vice versa. And you do need to lead by example, folks, as much as you can. We can all be great parents, and we don't have to be perfect. But I think now, if anyone thought that, oh, it doesn't matter that much, and every once in a while a kid might be a little sensitive. Again, this is becoming an epidemic. I mean, you see it talked about, but Dr. Kilbane here is seeing the people come into her office, and the stats are changing. And the thing is, I think it's also true, isn't it, Dr. Kilbane, that um, generically, my parents had less of a toxin buildup than I do, and then my kids are going to have more than me. In other words, it's built up over time. So my kids are probably going to have more toxins built up as a rule than I did, and then their kids. And so we're passing along a legacy of building toxins, and of course, more and more chemicals coming in, and we have to take it seriously. This is not a fad. This is not, uh, just look around. What did you say? Like, how, 1 in 30 kids autism used to be 1 in 5,000, did you say?
It used to be like 30 years ago, it was 1 in 10,000, and now
Okay.
it's one in
So
31.
so listen, everybody. I haven't tuned into the whole thing with Tylenol. It's in the news apparently. And the vaccines, all that. But here's the point. When you go from, 1 in 3,000 to 1 in 30 or whatever, that's serious. And blame it on what you want, but it's probably a lot of things.
It's a
And
lot. Yes. Yeah.
it
I
it
think sometimes in the media it gets simplified, and we are exposed to so many chemicals, and we know that babies in utero are exposed to so many
yes.
things. And so we've got be cognizant and before parents get pregnant, right? As this younger generation, clean up all of this stuff before you get pregnant, right? Look at nutrition, get your systems optimized.
Exactly, because like I think we can get into saying, well, is it Tylenol or isn't it? Is it vaccines or isn't it? It probably
Right,
sometimes is Tylenol, and probably sometimes is vaccines, and probably sometimes it's glyphosate, and probably some. I mean, it could be a lot of things, or the combination. Thing is, our children are not being healthy, and the children are our future. And I think the work you're doing is so important. And I also want to commend you. You do have so many good resources on your website. So people can learn a lot and they can start making changes because we are dealing with just good food and a couple of supplements. It's not controversial. It's easy to do. And I really want to commend you for what you're doing. Thanks for chiming in because I want people to take this seriously. Lord knows there's so many confusing, weird things in the media. A lot of times we just like, never mind. I can't deal with that. But it's so, so very important. So I want to thank you for being with us today. I want to thank Village Green, Village Green Apothecary at myvillagegreen.com. They sponsor this and bring it to you, and we appreciate them. And
love them.
you can get online, and like I said, that we have a whole library of wonderful, wonderful things. But thanks for coming on and maybe giving some parents hope because you have really good, simple guidance. It's not complicated and it's common sense. Everything you said is very basic and common sense, but I know from your work, your results can be really profound. So thanks so much for being on the program today.
Thank you, David. Appreciate it.